Afternoon and welcome to this public accountability meeting. I will introduce people as we go, I think, if that's all right. The minutes of the previous meeting are on the internet for people to see, so people can review, have a look at, review, watch the previous meetings. As opposed to there being formal minutes. So if anybody wants to do that, they can do. We've had arranged a number of public questions that have come forward. So as we're just waiting for one or two people, I propose that we take those public questions now and get on with them. The main theme coming out of the questions is around the performance of the force control room, which I know we're going to cover in the performance pack, but just in case people don't want to wait that long for the whole of the meeting, I'm just wondering whether there's an opportunity, Phil, Deputy Chief Constable Phil Kane, to just give us your overview of why the force control room is so stretched at the moment, because we've seen a significant uptick in the number of queries and complaints around that.
Yes, Julia, of course, but Superintendent Jason Dixon's on the presentation today. So Jason is Superintendent in charge of the control room, so I'll go into more detail later on. Yeah. But essentially, the challenges around COVID-19 have seen us been required to separate our control rooms from 1 to 2. So the site is now split over Harrogate and York, so our staff can work safely in the environment that they're doing. That's obviously brings us some additional challenges in terms of logistics and supervision that come with that. Also, we have seen a return to some previous levels of demand, and actually some of that level of demand has been surpassed prior to COVID. So we've got the challenges around COVID. We're starting to see our crime and other types of demand and calls through into the force control room 101 and 999 system start to exceed what was pre-COVID, and again there's some challenges around meeting some of the demands there. So Jason and the team are working hard in relation to that, and actually what we've seen is we've seen a peak in some of that demand, and we're starting to now put some things in place to start to get back on top of that as we were pre-COVID.
Okay, that's really helpful. Thank you. So, and we will, Jason obviously will be providing some further information on that as we go. So that's really helpful. I mean, I think had we not had issues with 101 in the past, perhaps people might not have been quite so concerned about it. But I think because we have had problems with 101, people think possibly that we're going back to those issues. And actually, there's a combination of factors here that is quite unique, including COVID, of course. And I hope we're not seeing a lot of calls around things like sort of people not wearing face masks and those sort of things, because clearly the police have demand and policing business to deal with, which they will always prioritise, I would hope. Okay, so the second area of questions are around the BAME representation in the fixed penalty notice statistics that we released this week. I was wondering if you could just give your view on that. People asking why that has happened.
Yes, absolutely, Julia. And I think before I go into that, I know that yourself and your team as well were absolutely passionate about making sure that we identify and tackle any disproportionality that's identified in any of the services that we provide to all of our communities. So the fixed penalty notices is one area, I think, that we as a force identified very early on in terms of the response to COVID-19. Again, raised that with your office, and thankfully and gratefully you've brought some independent scrutiny in to have a look at what we were doing there. So that has identified that we've got disproportionality in the issuing of fixed penalty notices around COVID-19, particularly to the younger Asian male cohort. Now, when we looked at that in more detail from the independent scrutiny, that identified that our local residents from the black and minority ethnic communities were not disproportionately issued with fixed penalty notices. However, we have disproportionately issued those to visitors coming from outside of North Yorkshire area into North Yorkshire, predominantly those coming from the West Yorkshire area into North Yorkshire. So whilst the independent scrutiny group that looked at that was happy that the individual issuing of those tickets was legitimate and was within lawful and reasonable bounds, the challenge still remains that we have disproportionately issued a number of fixed penalty notices to the community, the black and minority ethnic community visiting North Yorkshire. So we're undertaking some further work in relation to that to identify the root causes of what that might be, and again working with your office and the community to see what we can do to address that and learn from that, but not only for the fixed penalty for COVID, but actually for the wider use of police powers, stop and search, etc. as well, so that we can take that learning across. So I think there's still further work to do on that one.
Okay, thank you. So can I just make a suggestion that we bring it formally to Pam to this meeting once we've done a bit more work on that? So maybe we can take that as an action. Would that be all right?
Yeah, absolutely, Commissioner. I think just to note, though, that this is to understand, get into the root causes and to make some changes is probably going to take us a 12-month period. So if we can bring that back as milestones, I'd appreciate that. Yeah,
that's no problem at all. And I think myself and Tom have got some meetings with some community representatives this week. So I think we're keen to try and sort of engage them in some of these issues as well. So I think that'll be helpful. Okay, then we've got a few questions around police visibility, particularly in the Selby and Tadcaster areas. I just was wondering, what some of the challenges are around that at the moment.
Yeah, so again, I've read the question there, and firstly, I would like to apologise to the member of the public who's raised that question, that they haven't had the contact from the local inspector. I will ensure that is addressed as soon as possible, and local contact is made with the member of the public. But in terms of the visibility in Selby, so we've appointed a new sergeant recently to Selby Town Centre, and they are actively pushing additional foot and cycle patrols, and we've seen a noticeable increase in the last few weeks since the sergeants put in place their operation and their strategy around that. So I think that's a positive move, and hopefully members of the public will start to see some visible benefits from that going forward. I mean, some of the challenges we do face in Selby, it is a large rural area. There are various rural villages that are spread around, and to actively get across the Selby district, we do have to use our cars and vans to cover the area properly for all of the communities. Otherwise, we will be focusing on the urban elements of Selby and missing out on the more rural areas. So we have to strike the right balance. That balance is difficult for us to maintain all the time with some of the other priorities that we've got. But again, I think with the placement of the new sergeant, we should hopefully see some difference for the foot and cycle patrols. With regards to the drug supply in the area, again, this is something we absolutely need community support with to get that community intelligence so we can carry on tackling some of the drugs issues there. And actually, we've recently set up an operation called Operation Armour, which will look to target the exploitation of vulnerable children and adults in the area around drug supply. So that work is ongoing right now. But what I would might ask and plead for the community in those areas is please keep feeding that intelligence into us, because it's only on that intelligence that we can take the positive action that we need to take.
Okay, thank you. I suppose this is just quite a good point to say that we've been successful in getting over £500,000 worth of funding from the government, which was announced this week, and that money is going to be spent in the Selby area. Particularly because it suffers from cross-border crime. our analysis shows that it's one of the areas that is most vulnerable cross-border crime. So that's over £500,000 that's going to be going out into the Selby area. So that is really good news, and hopefully we'll be able to learn some wider lessons around that piece of work to help other parts of the county as well. John, there's just one question for the Fire and Rescue Service here as well. Are you all right to take that? John, I can't hear you.
Sorry, can you hear me now?
Yeah, that's better. It's about long-term sickness rates. Can I just ask somebody else to go on mute, please, if you're not speaking? So, John, there's a question here around a potential increase in long-term sickness rates in the Fire and Rescue Service. Could you comment on that, please?
Yeah, certainly can, yeah. It's actually in relation to our on-call sickness levels as opposed to our whole town. We report these two separately. The increase has been within our on-call long-term sickness during that period. And unfortunately, there's no real trend with this. There's a number of our on-call staff who've injured themselves, broken bones. One's got a broken hand, one's got a broken foot, another one's waiting surgery, and that's where the sickness is attributed to this time particularly. But the positive is that our overall sickness levels are down compared to last year, apart from that one part which is on the on-call service. But that is just due to individual injuries, which are not necessarily gained through injury through the fire service. It could be through primary employment, maintaining the health and fitness, and other reasons. Okay,
thank you for that. So, okay, that's I think concludes the questions. There's only one other question, and that is from George Howard. George, we have had a discussion about your question in the past, and I do believe Simon from my office has pointed you in the right direction of that. If you've got any further questions around that, please feel free to send them in after this meeting if you don't feel that those questions have been answered in the past. So I think we'll now move on to the substantive elements of the agenda. The first thing then is to hand over to the Fire and Rescue Service for their presentation on effective engagement. John, can I just ask, are you going to take this item, or is Dave?
I will.
Dave, okay, fantastic, Dave. So thank you, Dave, for leading on this.
Can somebody just tell me if it is on the screen?
It looks as if it is to me. So unless anybody flags it isn't, I will assume that it is. So if you want to go ahead, Dave, that'd be great.
Okay. Well, good afternoon, everybody. We've been asked to provide a presentation on effective engagement. The next slide really is a little bit of a scene set, I suppose, really, more for the public than for the people in the meeting. But we've now presented on this is the fourth of the priority areas that we're going to speak about today. You've had the other three. I think the significance of this slide really is how interdependent these four priority areas are with each other. And so I'm sure you'll have seen in the previous presentations, and hopefully through this one, that they are very much linked together. There is a thread that runs through them, and so as a service we're very much not looking at each of these priority areas in isolation. So I think that's quite an important point just to raise at the very outset for everybody. So with regards to effective engagement and the fire service, these are things that we are currently doing. We are very much focused on involving our communities in developing our services. And this is something that we currently do, but we are really focused on trying to develop this approach and be better at it going forward. So with that in mind, we're very much focused on how we can learn from other people, look at new ideas and innovative approaches to work with the community and other agencies. Working collaboratively with partners to best understand vulnerability and risk by sharing data. This is something that we've been particularly focused on over the last few months through the COVID period, and really have been working closely with some of the upper tier authorities in particular, and some of our other partner organisations such as North Yorkshire Police to use available data sources, be they open or closed, to better understand what vulnerability is, where it is, who's affected by it. And we are starting to see some real progress in the use of data sharing between both fire and those other agencies. And of course, this is very much a reciprocal approach as well. So the information data that we've got inside our own organisation, we're very much wanting to share where appropriate with other agencies so they can better understand the fire element of vulnerability. And the final part is about raising the awareness of what we do and the services we deliver. And I will touch on that a little bit later on in the presentation. But in brief, we currently have quite a mature programme of outbound distribution or dissemination of information about what we do through various means, traditional and social media being one of those. But we're really trying to reach out and look at how we can expand that wider. So the fire service, when we've been putting this presentation together, we've reflected a little bit on what we believe to be our strengths, what we think we're actually really quite good at. There is, I think, a general recognition borne out from a lot of surveys and a lot of feedback that we get that the fire service in North Yorkshire in particular, we are a trusted brand and we do have a proven track record for accessing and supporting vulnerable people and those most at risk. One area that we've really, well, not so much improved on, but developed and enhanced our involvement with is about our partnership working. Historically, we've always been involved in a number of partnerships, some statutorily, some voluntarily. But over the last 12 months, we've really seen growth in the partnership landscape. And so we're now very well positioned at strategic levels in things like some of the community safety partnerships, particularly the North Yorkshire Community Safety Partnership. We now lead on a number of the groups, particularly the strategic group for the Road Safety Partnership in North Yorkshire. We've now got a place on the Safeguarding Adults Board in North Yorkshire and some of the subgroups that fall out from that. And also we're now present on some of the other partnerships like Prevent, the Serious Crime Board and the Disruption Panels, all of which are bringing work back into the service for us to contribute and deliver on. So for example, when it comes to disruption, we've been very involved with partnership approaches under something called Operation Alligator, looking at modern day slavery and crime, particularly in the York area, which led to a lot of some arrest and eventually has led to some closure of some premises in the York area. We're very good at identifying where we see opportunities to benefit the public by working collaboratively with other people. When we see those opportunities, we're very quick to try to energise that, to make something happen within it. We have a very strong can-do mentality. It's part of our sort of, it's embedded within our culture. That's what we do. We see problems and we want to try to fix them. And so where we do that, we do move on and try to work with partners effectively and try to get a good outcome from the work that we engage with. We've got a lot of a comprehensive range of youth engagement activities which we deliver across the whole spectrum of ages up to the age of 18. And like I say, we're developing our understanding of broader community issues. So we're providing internal training to our staff. There's a couple of examples there. We've done it through the lockdown period, particularly around some of the safeguarding issues. So we've been introducing things like the early help strategy for the Children's Safety Partnership and adults who self-abuse, which is about hoarding in particular.
Dave, sorry, before you move on, just can you go back a little bit, please? Sorry, So the title of this presentation is Effective Engagement, and I suppose what I want to understand is, how do you know what you're doing is effective?
I'll come to that in a little bit, Julie, but basically what we are looking now is focused on outcomes. So the work we do now, we're trying to move away from outputs very much to outcomes, and we're using a range of tools, some of which are quite new to us, about how we can actually measure that outcome or that effectiveness. So for example, we've mentioned it before, but using things like the social value engine to actually use financial proxies to identify the return on investment of what we're doing. We get feedback from our partner agency to say, have we delivered on what we said we were going to do? A really good example for that would be the work we've done with North Yorkshire County Council during the lockdown period. They had a list of just over 26,000 people on the shielded data, the shielded list. They had a comprehensive outbound calls program to reach out to members of the public that were on that list. And we contributed that by making contact with just over 6,000 people during about a 6-week period. Some of those people had some quite serious issues, particularly around social isolation. Some people had actually had some significant medical problems, which we were able to alert other agencies with. And this weekend just gone, we've just made contact with around 80 people who are on the really hard to reach list. So the feedback we're getting from other organisations like the County Council, I think is telling us that the contribution we're making is really making a difference.
What I want to see is measures for this, so which links in with the outcomes that you're trying to achieve and trying to measure those outcomes. And at the moment, it's a little bit ad hoc. And it isn't structured, and so there's still quite a lot of work to do around that, I think.
Yes, I think it's a very good point, and it is very much like it's embedded. We've rewritten our strategies across the piece. We're just developing or fine-tuning the certain prevention and protection and service delivery strategies, and absolutely included within that is what you just mentioned there. So they are now very much based on or have included within them an evaluation framework and very identifiable outcomes that we'll measure ourselves against. So the strategy is the starting point for that, and they set that framework for all people in service to deliver against.
Okay, John, did you want to come in?
Yeah, if I may, please. It's a good point, Julia, and something that we're very much aware of is how we need to be able to demonstrate our effectiveness more so now. Data is very much a feature that will help us do that. And as Dave's just rightly said there, we're just bringing to a conclusion our draft strategies, which will go to senior leadership team shortly for ratification, and that then sets us in the direction of getting some clearly measurable outputs from the work that we're going to undertake. So it's a new area for us, but it is developing and it is coming on.
Okay, so that's really good to see. So when are you going to be able to bring that back to this meeting?
The actual strategies or the
outcomes that you could be measuring? The outcomes, I would suggest, will take at least 6 months to get anything to be able to show the results of that, because obviously they need to be delivered, they need to be embedded, and then we need to be able to demonstrate some numbers against that. I'm not interested. What I want to see in the short term, John, is that framework, that what you're going to measure, as opposed to wait 6 months to see if you've measured any. So I want to understand what it is you're setting out to measure, and so that the public can be aware of that as well. Okay,
so the strategies are going to the August strategic leadership team, and at that point, once they're ratified, then we'll be able to bring them for further dialogue with.
Okay, fantastic. That's really helpful. Thank you.
So if we just move on to where we think we've got some challenges, and I think you just very eloquently covered one of the main ones there around sort of evaluation, and that's very much something we're focused on. fully engaging with communities to understand need. This is really about making sure that we engage with the full range of people within the community, be it business sector, people actually in the community themselves, our partners, to really understand what the risk is and what the requirements are of those people. Building a data-led approach to service delivery. This is something that we've been aiming to do for quite some time. I think we're starting to see some real progress now with this. We're getting access to, or we're talking about access to a range of different data sources. In particular, we're putting in place information sharing agreements with a number of key partners.
So Dave, sorry, just on that. So I've been in this job now nearly 8 years, and we've been putting in place information and sharing agreements for 8 years. John's nodding.
And I think we're making finally some real progress on this one. The two that we put in place during lockdown, they released a number of data for us to actually work on. I've just given an example of that with the shielded list. I think what that's demonstrated, though, is it's not just about getting the data, it's about what we do with it. So we've worked very much in a collaborative way to actually help those people who are most at risk at that particular time with an adequate response. I say working particularly with North Yorkshire, it's really quite, it's moving at quite a pace now, and it's starting to feed into our risk resource model about how we can access that sort of data and information to help us furnish that and build up our community risk profile.
Okay, so I'm going to bring Tom in a minute, but obviously this was one area that HMI wasn't terribly impressed with. So I think probably, again, a future PAM, it might be good to have a specific update on the progress you're making in this area and how that really links in with your with the resource model that you're doing at the minute, because I think that's perhaps not as far advanced as perhaps the original timescale envisaged. So I think it'd be really good to bring that back to this meeting as well. So Tom, did you want to just come in?
Yeah, just a further question around that. Really, please. I mean, I think, Dave, actually, we've had this discussion in the past. You know, one data sharing agreement is all very well, and hopefully that does achieve the impact that you're seeking to. When you're putting these in place, are you making sure that they are relatively broad and wide ranging so that they allow for ongoing data sharing and data access rather than? Because it's the access point rather than the sharing. We all agree we can share stuff, but it's actually accessing it, isn't it? So is that the kind of key focus of those?
Very, very much so. I mean, the relationship and the model we're trying to build now is something that will be able to be refreshed and updated based on new and available data that comes from other agencies. So the kind of phrases, language you just used is very much key to what we're trying to establish and are establishing with our partner agencies.
Great, thank you.
Okay, so I mean, this you know isn't. I mean, it sounds a bit dry, this subject, but actually it is really, really important. And I think if you're going to make progress against the HMI FRS's recommendations and actually do a really good resource and risk model, this is absolutely at the heart of it all. So it'd be really helpful to maybe come back in towards the end of September with progress on this. Yeah, that'd be really good. Okay, thank you. Sorry to press that, but it's fundamental.
I think we're very much on the same page with this commission. I think that's exactly the approach we're taking. We understand the significance and the relevance of it in the short to long term, and that's why we're trying to do the things that Tom has just said there in terms of those, it's a long-term approach to access rather than just sharing. So obviously that leads on. This is designed to flow as a little bit as a hierarchy, but then allows us to align our resources to those needs of the community. We recognise that we have issues around accessing certain parts of the county, particularly in more remote rural areas. As a service, as an organisation, we're very much wanting to create an inclusive and open work environment. So this is making sure that our staff, not only feel valued but feel able to contribute in a very inclusive way to the development and growth of the service and the work that we do. Broadening the diversity of our workforce. This is really a a long-standing issue, something I'm sure that's been spoken about before. Again, looking at how we can look to broaden the diversity of our workforce, but also to allow us to benefit from that diversity of thinking as well that brings. So we're not just wanting to, we're wanting to make sure that we can sort of benefit most from having a more diverse workforce.
Okay, so Dave, again, I mean, we have travelled this ground quite a lot, but I remain concerned about this, and in particular, I think that in the recent recruitment, more could have been done, and I suppose I would really point to the work that the police have done on this, and really encourage you to properly engage with the police. And understand what it is they have done, because I'm not sure that engagement has been as effective as it could be. Yeah. Tom, do you want to come in?
Yeah, I just wanted to really develop on that, because as you say, we have travelled this ground in the past, and I wondered, given that we're talking about challenges that you think you face here, what do you think the specific challenges are that the fire service are really struggling with around actually engaging with those communities to encourage that participation and that interest in the first place?
It's a very good question, Tom, and in a moment I'm going to put a slide up. If we were to answer that question in the meantime, I might have a better answer for you. We have tabled a question called the EDI board, which is basically to carry out a review of our recruitment and promotion processes over the last 12 months across the service. And the EDI board is there to sort of sponsor and facilitate that evaluation, or that look at what we've done. And I think that once that piece of work is done, that should hopefully give us some of those answers that you're seeking right now. I could speculate on a personal view, but I'm not sure that's the right thing to do right now. I'd rather give you a more formed opinion based on the proper evaluation done by a group of people, if that will be acceptable.
Dave, can I just ask on that then? Is that evaluation, as you say, is that actually going to engage with those communities to try and understand that? Because I mean, one of the other questions I had in relation to fully engaging with the communities to understand their needs is vice versa. How can members of the public get engaged with your work around this if they think there's particular risk in their local area that they don't think is addressed? So in both those senses, if there's a local risk, but also around these issues, broader issues around diversity and the like, how are you actually engaging with the community to understand what it is that you need to do?
On the latter part then, Tom, this is something that we've got examples of where over the last 12 months we've been out to communities and talked about the risk and how we're meeting the risk, particularly with our response model. So we've got examples where we've been up to, for example, Loft House, looking at a volunteer unit, or some other stations where we want to relocate some of our specialist vehicles, the TRVs in particular, and we've engaged with the communities and spoken to them about what it is we're doing, why we're doing it, what we want to achieve, and what their contribution can be to that. And so, for example, we're now seeing an improvement in working with employers. Obviously, the on-call model relies on people who are, if they are employed in primary employment, to be released by the employer to come to work for us to serve the community. So raising and improving the awareness of what we do and how we do it, I think has been something that we've started to do a lot more of, and we've seen some proven results. Ones I've just given you there are examples of that, where we've now started to see better engagement with employers and actually an increase in the number of people that are able to work for us in our on-call stations.
So sorry, Dave, I just want to challenge that a little bit, because we've had a sort of COVID interjection with all of this. And of course, on-call availability shot up during COVID when everybody was at home and locked down. And I don't understand how you can disaggregate that effect from from having, conversations with employers, and how you can point to the effectiveness of your actions around all of this.
So the figures about on-call availability, I fully accept what you said about the COVID lockdown allowing people to be present at work for us. But when we look at the establishment and the amount of people that are now forming part of the team at a particular station, we've seen that go up as well. And I think that is a direct correlation to the fact we've started to work better with employers as part of the recruiting in local areas for on-call staff.
Okay, because this is one of the, and we all know that this is one, and I'll bring John in a minute. This is one of the real critical areas. If you are making serious inroads into that, then you need to find a way to present that to us in a more compelling way than sort of anecdotes, if you like, because it's such a critical area in terms of the availability of appliances and your ability to deal with risk in local communities. And it's been such a difficult thing and such a challenge that I think we really need to understand properly the work that you're doing around that. And I know it's one of the main themes of Andrew's vision is around all of this. Yeah. And I want to understand, properly how much progress has been made against that in a more formal way. I think that's quite important. John, do you want to come in?
You're on mute, John.
Yeah, so the number of areas I'd like to just discuss here, really, and elaborate on. So in terms of attracting a more diverse workforce, it's a very complex subject, and we have some real challenges in North Yorkshire that other services don't experience. So we have got 7 day crude stations, which means that people have got to live and work within 5 minutes of that fire station. That means that if it's people from diverse backgrounds, they may well have to uproot and go and live at that fire station. That means taking their family with them, perhaps spouses, partners, and other people to go and live there as well. So they're challenges which we've got to try and overcome and put some measures in place to try and overcome that sort of thing.
But John, that doesn't apply to women, does it?
It does. Well, it means that if a married lady lives in West Yorkshire, for example, for her to come and work at Whitby Fire Station, that would mean uprooting and going and living there. That's a huge challenge.
There are plenty of women in Whitby.
There are, yeah, I appreciate that. There are, but they're the sort of challenges when we're looking at bringing in transfers as well. But there are some real challenges, and it means that. So you might have someone who lives at Lythe or Robin Hood's Bay, for example, but that means them moving from that place to Whitby because they've got to be able to respond within the timescales. So there are challenges there. Not that we can't overcome them, but when you've got shift stations predominantly, it's far easier to attract more diversity in.
So I get that, John, but from a gender perspective, let's alone, I think it's 12% of your entire workforce is female. I mean, that is a very low starting point.
It is, yeah, and it is. We are actively engaging as much as we can do. Well, I say as much as we can do. No, we can always do more, and we will do more. Back to the strategies. Part of the strategies are that our district managers will now attend and be present at future parish and town council meetings to get that message out there. Again, back to some recent experiences. We've had good experiences of attending public meetings and getting the whole community behind us, which then brings employers in to help us with the on-call recruitment in local towns where we've had for years real reluctance. Really present the problem out to those communities that they then have, get on board and help, and that's something which we really want to maximise and expand on.
Yeah, I understand. And there's been, Ripon and Massam area has been quite successful in that respect, hasn't it? So, but I suppose, when you look at the sort of positive action work that the police are doing around not just engaging and trying to attract people in the first instance, but actually getting people into role and keeping them there. That is something that I think the fire and rescue service needs to just consider a bit more than perhaps it has done already. Tom, did you want to come in? No, you got your hand up. Sorry. Okay. All right. Do you want to keep? Sorry, I've given you a grilling on that one, John. But it is so important that we do absolutely everything we can on this. And you know, as you can tell, I think progress has been made, but I still think there's quite a long way to go. So do you want to pick it back up?
Yeah. Yeah, well, thank you for those comments, and I say that is something that we are very much focused on going forward anyway. But it's good to get the challenge and to you know, keep it on the forefront of our minds. With regards to opportunities, we have had the benefit of striking new partnerships. I've mentioned them a couple of times already during the pandemic. There might have been old relationships, but I think the approach we've taken with those organisations has been quite fresh and new, quite invigorating, and it's allowed us to work differently, quite smartly with them. So it's about looking at how that's being done and capitalising on that going forward. Obviously, you've mentioned, or I've mentioned, the risk resource model. This is a big significant piece of work that we're undertaking at the moment, and part of that is to develop the community risk profile. So this is about how we engage with the communities, the diverse community, to understand best what that risk is or what their needs are. And the next slide, I think, will hopefully illustrate how we're going to use the EDI board to do that to best effect. And these next three words, we've used them a few times already, but where we really need to be and want to be is about how we engage in conversation through discussion, dialogue and debate. And they're basically like there's three stages. So opening up the ideas with people, getting really into sort of sharing views and opinions, and then debating them, so that when we can thrash things out, so that we can move out the humps and the bumps, so we can get to a point where we think we've got a workable solution going forward. And these three are predicated on being open and transparent. So we've done things now where, for example, both TLT, our tactical and strategic leadership or senior leadership team meetings, there's an open seat for a member of staff to attend, so they can actually see what's going on. All minutes are publicly available to members of staff, so they can see what's being covered. And we want to engage with all stakeholders in that way. So very much like a cornerstone of how we're moving forward with our engagement. This slide really is there to illustrate. Sorry.
Just one other thing. Have you ever done a cultural audit?
I'm going to say we did do something, but quite a long time ago.
I think now might be a good time to consider that, because and that might be something that the EDI board might want to think about, because I just think that there are. So I'm getting a bit of feedback. You might have sensed this around some of these issues, and I'm not really content with where we are at the minute, and I want to really understand, you know, the basis of the culture in the fire and rescue service, both on station and, you know, amongst the sort of the middle managers and the senior managers. I'm getting feedback around this that is challenging me at the minute.
We did do something. I think it was to quite a small sample group on something called Competing Values Framework, and I don't think it was deep enough, broad enough and robust enough. So I'll take your points and I'll feed that back to people inside.
Thank you.
Okay. So this slide really is there just to illustrate to people in the meeting about how we're looking at EDI. We have a group now, board that's set up with leads on these particular areas. That list is not exhaustive. It can grow to other groups as well, but they're there to provide the subject matter expertise to the teams you can see there, the SLT and the TLT in particular, who will be there to sort of like challenge things like the RRM, the risk resource model. So I've mentioned a couple of things already, particularly around how we're going to look to scope out a review of promotion and recruitment processes, which is what you've just been talking about or challenging us on. and that's the group that will help try and support some of that work. But also, when it comes to things like the RRM, what we want to do is to properly engage with all members of the community, the wider community, and we'll be looking to that EDI board to help understand how to do that, what the barriers are, the challenges are, and how we can remove them so we can effectively engage as part of that modelling.
So how long has the EDI board been in existence?
I'm going to say somewhere in the region of about 12 months.
Okay, and so can you give me an example of something it's done that has made a difference so far?
I think what it's done is it's raised the awareness on those areas that we've got there. So the LGBTQ, for example, has raised quite a lot of awareness around issues pertaining to that. The neurodiversity, we've brought information into the service so people better understand some of the issues and challenges that people have got who suffer from neurodiversity problems. I think what it's offered so far is an awareness and understanding. The kind of things that I've just mentioned today around scoping out evaluations and something to do with the RM, I think will be more tangible pieces of work we would like to see the EDI group getting involved with.
Okay, so has it got a set of objectives around what it's trying to seek to achieve?
It's got agreed terms of reference. It's chaired by the chief, and this slide really is taken from a presentation from him about how it feeds into those groups. So as you know, this structure was brought into being in April of this year.
Okay, so I suppose, but a terms of reference is different to a set of objectives over a period of time. If you see what I mean, it's a different thing. A terms of reference is a different thing. Yeah. And you know, it's all very well having a board, but actually, what impact is that having on stations? How is it changing behaviour? How is it encouraging the positive behaviour that you want to see? And how are you having those difficult conversations to challenge behaviour that you don't want to see? You see what I mean? There's real practical stuff that needs to be done. Tom, did you want to come in?
Yeah, just it's a question around this slide as well. We understand, and from what this shows as well, it seems that way. We understand that the staff network leads in those kind of different areas will be the main link between the EDI board and the service as a whole and those particular communities. Now, just again thinking about the experience of the police there, that's a significant undertaking to do the amount of engagement and interaction and encouragement and so on and so forth with those communities for single members of staff. And we just wondered a bit about, you know, what support they will be getting to really make sure that they can be as effective as possible in engaging those communities, please.
So, John, just before you answer that, Dave, John, you want to come in as well?
Yeah, thanks for that. So I'd just like to answer Tom's question a little bit there, because it's probably not portrayed quite accurately there. And whilst we've got the leads for these people, they won't actually be having to do the engagement in isolation on their own. We've got a district team of management out there, and their role will be to help and encourage locally and build those networks locally, so that ultimately what we want to see is this be truly embedded within the district area, so that they can go and engage with the diversity in their community. And so I think that it's important to just recognise that the leads will be assisting the development of that within the districts.
That's really helpful, John. Thank you. So just to pick up on my point then around the practical things that are going to happen as a consequence of the EDI board and these groups, how are you actually changing behaviour and attitudes in the service?
So again, it is what you said there about challenge. It's about forming new teams. So we've just in the process actually of appointing 7 new station managers. We've just taken 5 new group managers on. We've got a development day coming up in September, whereby we really want to bring all of this together and really start an embed and go forward using the frameworks that we've now got. And their role will be absolutely clearly to challenge some of the behaviours that may be out there. I'm pleased to say that it's not as bad as some of the services, but nonetheless there are things that we've got to challenge and need to challenge out there. But this will take some time to try and change the culture. But please be assured that that is absolutely that middle manager's role to start that process. But then it needs to be devolved right the way down. And the new ways of working under the intent-based leadership now, that means that the supervisory manager layer of managers within the organisation are in the same place. They need to step up on this one now. Okay, so I'm not going to ask any more questions about it. I've still got a lot of questions around this. So I think I'd like to take this offline and really do look at this in detail. I'd like to have a look, for example, at some of the outcomes of your employment tribunals. I want to have a look at how women in particular are feeling in the service. There's a whole range of things that I think we need to really understand. So if that's all right, we'll do that and perhaps come back to this in 6 months' time. Tom, is there something more you want to add?
No, sorry, just to say that we've got this topic coming up on the PAM schedule, so we will be coming back to this in the near future. Yeah, it's I want to see the practical stuff that is actually happening. So how are managers being trained? And all of that sort of stuff, because there's a lot of work that I think needs to be done. Okay, sorry. Sorry, Dave. I know this is entirely my fault, but can we try and just speed through a little bit of stuff, because I am conscious of time, and my apologies there. Oh, Dave, you're muted.
Yeah. There's only 2 more slides, Commissioner. So basically, this is what we're trying to do here. Place-based approach to community safety. We've got the public safety officer role in place and being trialled, so that will be pending an evaluation review. Some of the words you've been talking to there about really understanding how well the workforce feel valued and listened to, and to develop our work with the voluntary sector. So this is something that we've been looking at again. I can't give you a real example or a lot of examples of this, but following through from the pandemic in the Nile recovery group, this is something that I think we will start to see the benefits of, is how we can engage with the voluntary sector better. And finally, what do we think it will look like?
Sorry, so, Dave, I do want to just come in quickly if I can on the workforce aspect there. A few questions that I have around especially mental welfare of the staff over the past period. Obviously, in the past, when you've presented on this, or the service have presented on this subject, we've had a very good understanding of the helplines and programs and schemes that are set up to support staff welfare around these things. I just wondered, and apologies, I know that you haven't necessarily had the chance to prepare for this one, but have you got any indication of how many of your staff are actually accessing those helplines at the moment, and have done especially over the last 3 or 4 months? The other thing to note there is it's been a while since you've conducted a staff survey. I was wondering whether you've got any plans around another staff survey in the near future. Obviously, there have been a number of promotion competitions recently as well, and just wondered whether you have any kind of understanding around feeling and welfare as a result of those for candidates involved in that. Thanks.
I can't give you a number for how many people have access to support helplines. I know that there is a provision out there for people, and it's routinely offered and promoted by managers to staff at various stages of, or for example, at serious incidents, it's something that's quite routinely offered. But it's not just done in a way that says like a tick box type facility. I think people do explain why it's important that if people are struggling, they can access that support. Whether or not we can provide that outside the meeting point, I don't know. It's maybe something that occupational health might be able to find out through our contracted provider.
Sorry, Dave, I think that's really important. I'd really like to understand that. I think that would be to get some insight into that, if that's possible. I think that'd be really, really important.
Yeah. Okay. I know we've gone through that provider. We had, this is going back a little while now, probably early spring, maybe a little bit towards the latter part of winter, actually. There were some really quite serious road accidents, particularly in Craven, with a couple of double fatalities one weekend. And I know that we provided some trim support there, basically where we got people in to work with the attending staff to make sure that they were given that real support at a time when we felt it was necessary. With regards to the staff survey, again, I don't know, and maybe John does, if there is an intention to do another staff survey. I appreciate that the one that we had was a little bit dated now. I think obviously how we listen to staff, doing some sort of survey is important. So that may be something that's in the pipeline that we can certainly take back and talk about.
Yeah, I mean, I think that links in with my earlier point about a cultural audit and how we assess the sort of health and happiness of the workforce at the moment as well. And I think that's something that we need to think about. John, did you want to come in?
Yeah, thanks, Julia. So a number of issues there, which I'd like to just help address. And I must say to Dave, thank you and well done for fielding those questions. Some questions there which are nowhere near Dave's field of responsibility or expertise. So well done there, Dave. So cultural survey, yeah, certainly something which we need to pick up on. It's a few years since we did a staff survey. 2016 was the last one. So we are due another one. We have recently gone out and done, in conjunction with Enable, a staff survey to get the feeling of how COVID-19 has been handled within the service. And that's been done both within North Yorkshire Police and Fire. So I haven't got the results in of those as yet. Back to the question about...
Sorry, John, did that cover welfare? That
covered, welfare and the general how it's been handled. So it was two aspects, and it also included some questions about on call and their future ability to work from home, etc. So still waiting for the results on that one coming through. Tom mentioned earlier about the competitions that we've run recently. And it's a real difficult area, is this one, whereby, we want to open up to a diverse workforce. We want to encourage people to come in from other services because that brings with them levels of knowledge and expertise. And it brings in, the whole range of diversity of thought, etc. But there's also a negative effect of that. And that's a feeling that our internal staff feel then devalued. And so that's something we've got to be very, very cautious of and very careful to manage as well. Because, it's not about saying that the people that we currently employ are not good enough. It's about, bolstering and trying to attract as much diversity as we can do, but also valuing the staff that we already hold and have working for us. And that's, something that, people, when they enter into competitions for roles and they're not successful, it does knock their confidence. So we've got to help them with that and put development in place for them. We're very conscious of that, and it's something that we need to work with our people on. So there's a range of things here, again, which we're very much aware of. and by digging into the culture, we'll understand a little bit more about that as we go forward.
John, can I just ask on the back of that? I mean, it's very encouraging, to hear what Dave says about the way in which these welfare services are promoted and pushed forwards after difficult operations and the like. And you walk around headquarters and stations, and there's posters plastered on the walls, left, right, and centre. Would you just from kind of personal reflection, do you think that staff understand that actually they're there for things like, I've been let down after this promotion board, and actually I do need a bit of support around that, and I recognise that. Do you think that they understand and would access it around those kind of issues as well, or do you feel that it is purely targeted at the kind of difficult operation and some stress following that?
It's a really good question, Tom. I would like to think people feel it's there for the wide range of challenges and such that people experience within their life. It's not purely about the operational aspects at all, and we do offer out that service to our enable staff that don't actually attend incidents. The uptake of it is not as great as we might like to utilise and access some of these services, and so perhaps we should try and do more to encourage that. But ultimately, it falls down to the individuals to actually be proactive and go forth and do that. So it's a real difficult one. It's something that we need to keep trying to encourage people to access these support mechanisms.
Okay, thanks. So let's just, as we said, a bit of data around that would be interesting, I think. So let's see if that's possible at some point. I'm just conscious of time because you've got your performance pack as well. So if we can just, Dave, sorry, and I just echo John's thanks for responding to some possibly challenging questions. So thank you.
All right. I will try to just wrap this up really quickly. I mean, a lot of it is around, you've touched on a lot of things in here about how the staff feel. And John's comment about the development day for new station group managers, I think, is really important, because that will bring together a new cadre of middle managers with a real focus and emphasis on how we support staff in some challenging times going ahead, without question. So, I'm somebody who's been in the fire service a long time, and I do think that we've got the formal approach, which we've just covered, but there is a strong network of support there within the service, and that's being tested right now. So I think that people are very mindful of other people's issues and needs, and will provide that support and continue to do so in a very professional way. A lot of this is around how we work in partnerships. I've covered that in quite some detail. We will continue to build new partnerships and to develop existing ones, particularly around the access and the use of data, but not just about getting the information. It's about what we do with it and how we work collaboratively to basically reduce risk and work with the vulnerable in our society. So I'm going to call it a day there, Commissioner, if that's okay with yourself. I think we've kind of covered the main areas of how the fire service wants to and does engage with the community. I think there are some areas where we are effective. I think we've been very honest in this to say there are areas that we want to improve on, and we're looking for those opportunities to do that, and we recognise that there's going to be some challenges in front of us, but we are ready for dealing with those.
Okay, that's great. Thank you. I'm sure we've captured those actions. So if you want to now go on to your performance pack, that would be great. That's due to finish in about 7 minutes. Hence why I was trying to move the meeting forward a little bit. So can you just take any exceptions on performance, please, rather than going through the whole pack, just so we can keep on time?
Okay, I'll just share the performance pack up there. Can I just ask, is that visible on the screen?
Yes, that's fine. So that's great. So as I said, John, if there's just anything that you want to highlight, really.
Yeah. Okay. So incidents have on the previous quarter compared to last year are down, but that's largely reflected in April and May with the COVID and where overall incidents were down. I'll quickly go through the slides, but just touch on the high-level areas. You'll notice there that the RTC-related incidents, which we did experience a real low level within April time with COVID, has now started to increase slightly, but not significantly. But they are definitely up on where we were previously.
John, sorry, are some now that we're back to a bit of normality, are some stations back doing emergency first responder activity as well?
Not as yet. And that's largely down to the risk assessment and the PPE requirements and procedures for that, Tom. So we are still working with that Yorkshire Ambulance Service to get that back up and running, but hopefully that will be done very, very soon.
Okay, so that if you could get a bit of an ETA on that, that'd be helpful. I mean, I know we've got some good engagement with Yaz at the minute, so that'd be helpful. Thank you.
Yeah. Again, primary fires and the overall calls compared to last year is different, and again, largely down to the COVID outbreak, but nothing significant to really report on there compared to previous years, which isn't different to largely caused by the COVID. So I'll go over these. Interesting here are levels of home fire safety checks, which are displayed on this chart, are obviously low compared to previous years. Again, largely down to the control measures which we put in due to COVID, and they are now starting to increase. I think when it comes to July, we'll see a marked increase there. But that's not to say that other work hasn't been done. Dave touched earlier on about some of the interventions that have been taking place. So rather than actually going visiting people in their homes, what staff have been doing is making telephone calls, in excess of 5,500 calls to people with shielded data. And similarly on the business safety side of things, so there's been an awful lot of work going on there in terms of helping with risk assessment, getting business engagement people back to work. That's been ongoing, but it's not reflected within the figures here in terms of direct fire safety audits. So just an assurance there that other safety work has been going on, but not the normal, which we would be used to. So it's slightly skewed the figures, unfortunately, there.
Yeah, John, can a couple of questions there? It's particularly around the business safety side of things. Just a question about those high risk premises, the very high risk premises, especially. You know, given the fact that numbers aren't really well, they're not as high as they were and potentially need to be. How are you ensuring that those high risk properties and businesses and premises are still being audited effectively?
So that will now fall to the business safety teams to put their catch-up plans back in place, if you like. So that work is now being prepared and ongoing. We're working with the rep bodies and other areas to get the control measures in place, so then we can actually go back and recommence work. Then there will be a period of catch-up that has to be done. David, I don't know if you want to add any more to that. This is your level of area of...
So just in essence, we have something called a risk-based inspection programme that was suspended at the start of the lockdown, and we diverted work into other areas which John's just touched on. So we focused on what we call business engagement. That was targeted at some of the premises you just talked about there, Tom. So when you talk about high risk, you know, we have a range of parameters in service that we use to determine that as part of that RBIP. So, for example, care homes was an example of a a type of premises that we focused on. We made regular contact with them to talk to them about any adjustments or a change they'd made to their risk assessment, to their operating procedures, particularly around things like evacuation strategies. So we were very much like focused on those sorts of like purpose group is what we refer to them, and we did do considerable amount of work targeting those. We will, as John just said, we're starting to look at the strategic priorities and the risk assessments that were born out of those, and that should start hopefully to release some of the or it should allow some of the restrictions that we put in place in risk assessments to be released, and therefore we can go back to some of our more conventional work, one of which is fire safety auditing.
Okay, so so there's a lot of you know, work being going on around the sort of backlog in the courts, and I'm not for a moment suggesting that your backlog is anything like that of the courts, but it'd be interesting to get some timescales on when you think you get back to some sort of semblance of normal, bearing in mind obviously that this is, you know, a fluid situation.
Julia, I was going to say, if I may, it would be great to get an update on that outside of this. But just for the public's reassurance, I wonder, John, if for next month it would be possible to give a specific update about the recovery plans for the business safety audits and for home safety visits as well, please, because that would be really helpful for the public, I think.
Yeah, we certainly do that. I will just say that throughout all of this, our prime focus has been maintaining a response capability. So we have had to adopt our plans to make sure that our staff are able to respond to emergency incidents. And naturally, we are following government guidance along the way and adapting our plans accordingly. So, but yeah, certainly I'll get an update for next time on that one. Yeah.
Just with regards to public assurance, Tom, I would say that the two areas that we didn't remove from the RBIP were around dealing with complaints and also any kind of formal processes around legal action for non-compliance with the fire safety order. So those two were kept absolutely in the forefront if they needed to be enacted all the way through the lockdown.
Okay, thank you. So if you could just we just need to sort of get some sort of sight of that, John, if that's okay. Do you want to just finish off?
Yeah, yeah. So our overall appliance availability levels have been healthy during COVID, but we are now seeing a slight tail off with the on-call as people now go back to work. Unfortunately, we've not been able to do any on-call recruitment, as in a recruitment course. We had to cancel one which is due to take place in July, but we are now looking at increasing the number of courses. We're putting another 3 on during the calendar year to try and catch back up again. And again, the training that had to be put to one side during the COVID crisis is now back on track and indeed getting back on board with them all. So overall appliance availability levels have been healthy, I have to say, throughout this crisis. This is showing that we're at 90% available during June. We were 92% during the period in May and 96 in April. So you can see as people going back to work, our availability levels are reducing slightly compared to that. However, compared to last year, we are in a better place overall. And then back to our absence levels. Apart from the one which we covered in the earlier part about the on-call long-term sickness, all of the sickness levels compared to last year, the same period, are lower. So the short-term sickness for both whole-time and on-call is significantly lower than it was last year, the same period. And they're the slides that I've got to show. So I'm happy to take any other questions.
Tom, have you got any more questions? I'm okay. Are you? Yeah. Okay. So I'd like to say thank you very much, John and Dave. Sorry if that was a bit of a grilling at times. I apologise. I just keen to try and really sort of focus on the cultural stuff. I think it's really important. So thank you very much. Okay, so I think we are now on to North Yorkshire Police's enhancing the customer experience as item number 9. Who have we got leading on this?
That'll be myself, Commissioner.
Fantastic, Jason. Okay, so do you want to kick off then?
I'm just checking. Can you see that on your screens?
Looks good to me.
Excellent, thank you. My presentation is looking at enhancing the customer experience. There are 4 elements to it there. What I hope to achieve is to go through where our strengths lie in relation to those 4 objectives, what current challenges we face in relation to them, what opportunities are available to us, and where we hope to see ourselves in terms of results in the next 12 months and beyond. So in terms of strengths, what's working well? We have a centralised force control room which has its own self-contained training facility. That facility allows us to benefit from some economies of scale, having all the staff in one place, the supervisory oversight of them, and an ability to be quite flexible and responsive in terms of moving staff from 999 calls to 101 calls and other bits of work as demand changes during the course of the day. The training facility allows us to respond very quickly to changes in legislation, allowing us to train our staff without having to rely on other force-based training facilities. And it's allowed us to continue recruiting and training staff throughout the lockdown period. We have had a little bit of slippage in terms of our recruitment plan because we've had to reduce some of the class sizes down to allow for social distancing. But having that facility has allowed us to continue that recruiting, and obviously we want to get our staffing levels up to where they need to be. As Mr. Kane mentioned earlier, we have had to respond to the COVID threat by opening up Harrogate custody, Harrogate force control room. That has lost us some of those economies of scale because we're working across the 2 sites, but it's allowed us to maintain our resilience and being able to socially distance and protect our staff. And I think the key thing to mention there is the people within the control room, because they are what makes it effective. They are dedicated public servants, and they've gone the extra mile really in moving across to Harrogate and setting up that additional facility to make sure that the control room remain functioning throughout this period.
So, Jason, I'd just like to say I did actually have the opportunity to go and visit them in Harrogate during the lockdown, and I have to say they're a great team there, and they were enjoying it in Harrogate. They liked the view out the windows, which I think was considerably better than in York. But it was good to see that morale was high and people were, getting on with their job. So I'd just like to say thank you to them, because I know it hasn't been easy.
Thank you. That's very much appreciated. The next strength is moving to a learning, not a blame culture. So rather than just focusing on when things have gone well or not gone so well, we look at the learning that can be gained from that and making sure that learning is shared across the organisation. And I know, Commissioner, your office now leads on the complaints and recognition section, and that obviously feeds into that. And our own professional standards department issue an organisational learning bulletin every month, so that learning from complaints and from positive actions is shared across the organisation, so that we can improve the service that we deliver.
Tom, sorry.
Yeah, Jason, I just want to comment on that one. It's an interesting one, and obviously a lot of work has been done around this to try and change the culture around this as well, and things like the intent-based leadership as well, to try and open up and encourage people to manage themselves in a sense and take responsibility for their actions. Do we have any evidence yet as to what success that actually is. You know, you're talking about it here as a strength. What are we seeing as a result of all of that work so far? Phil, maybe you want to come in on this, and also when an organizational learning bulletin goes out, how do we know who's reading that, how far that is actually reaching into the organization, and what change is actually coming out of that learning being disseminated, please?
Yeah, so I'll pick those up, Tom, on in relation to that. So I suppose an example of how we move from a learning culture rather than a blame culture, actually the benefits that you've seen in the airline industry, where they are happy to report near misses, happy to report mistakes, so that the whole industry can learn from that. I'll use our data protection area of business as an example. So as we all know, last April, the changes to data protection legislation came in, requiring the organisation to manage personal data in a different way. So we put out the training in relation to that, and actually, as part of the learn and not blame culture, we really required our staff to come forward and tell us, for example, when they'd sent an email to a wrong address, when they'd sent a document to somewhere that actually it shouldn't have gone to, or wasn't marked correctly if it went to CPS or other agencies, even if there was no way that as an organisation we would individually find out about those. The fact that we are instilling the learn not blame culture means that our staff are coming forward with breaches in the Data Protection Act, and we are able to then openly and transparently share those with the Information Commissioner in relation to how our actual performance is around this. Now, as a result of that leading on from that, the way that we then know that we're learning from that is the monthly data returns that I get back into the information board that I chair show me that there's less reoccurrence of some of the early issues that we were finding, particularly around people using automatic email addresses and things, and sending data out inadvertently to other to people that shouldn't have had it, even if that was within the organisation. So there's one simple example there of actually, by staff having the confidence in the organisation, we're going to learn from our mistakes. We're not going to blame people. We're not going to discipline people unnecessarily. Of course, if needs be there, that still remains, and our recent public misconduct hearings will show testimony to that. But it's a simple example, really, of showing how learn and not blame can help improve performance and delivery to the public of the service that we provide. So I hope that answers that question in terms of that. In regards to professional standards side and the organisational learning bulletin, again, we've invested, we've got 4 what we call field coaching officers, and also in Nexus, and we've also got our professional standards team who reach out into the organisation now. So I actively encourage them to go out into the organisation to deliver presentations to departments and work with them on delivering against professional standards that we expect in the service. Now, a further example of that is a change to police conduct regulations that came in February of this year. Our professional standards department have delivered a presentation to all of our frontline supervisors with regards to the change in those police conduct regulations and what's expected of those frontline supervisors. So again, because it came in February this year, it's early days, but we're seeing some positive signs, and certainly I would suggest that that closer working relationship and the new procedures with the Office of the Police and Fire and Crime Commissioner, we're seeing some really positive signs in terms of how that partnership is developing as well.
Thanks, Phil. If I can, just very quick, I hate to be a skeptic. Is there a clear way of understanding, in your example around the data, that it is definitely as a result of that culture, and not the fact that in that having come up and something being done about it and it being reported in the process there, somebody along the line hasn't been not blamed for it, and therefore potentially isn't reporting it the second time it happens?
So I'd say that is in terms of somebody, if they're making a mistake more than once, or for a department or area. So those are the type of things, Tom, that we all know would quickly go around the organisation, and we would lose the confidence of the organisation in terms of that reporting. So whether it's the same individual or otherwise, those are the things where we would lose that confidence, and we're not seeing that at all. So in essence, what I'm seeing on the monthly data returns that I get is an increase in some of those reporting areas. And, you know, and again, we don't, in the way that we respond to those being reported, we thank the member of staff, we give them the information they need to improve their performance, and then we share that in a way that doesn't cause that individual an embarrassment. So again, it's a learning theme and a learning topic. So I think, again, it's just continuing of that. And again, the cultural change around that will take us some time to achieve, but there are some promising results early on that.
Thanks, Phil.
Okay, thank you. Moving on to the next one, an organisation that's open to scrutiny. I think we are very much open to scrutiny in a variety of forms, whether it be through scrutiny panels such as the stop and search panel that's run through the Commissioner's Office, or through more formal processes around serious case reviews and domestic homicide reviews. We're open to scrutiny in order that we can learn and aim to improve the service that we deliver. Next one, in relation to sharing information at Safeguard.
I just want to actually say thank you, because I think over the last couple of years we've seen a real improvement around that, and you know, it really has been good progress. So I just want to say thank you.
Thank you, Commissioner. Appreciate that. In the next one, sharing information. I know you've had a previous PAM in relation to safeguarding, so I won't go over too much of the detail of this, but clearly we share information with a variety of partners and agencies in order to safeguard vulnerable people and improve the service that we are delivering to them. For example, MARAC's Domestic Violence Disclosure Scheme and Operation Encompass, to name but a few. The next one, strengths-based recruitment approach. I'm a particular fan of this, as this was the recruitment that I underwent to join North Yorkshire Police, so I'm definitely a fan of this approach. It's an approach we've been using in North Yorkshire since 2018, when I think Mr. Kane was the initial candidate that went through that process. And where this differs to a competency-based process, a competency-based process looks at what you have done and what you can evidence, whereas the strengths process looks at what you're good at and what motivates and infuses you. So you can get a very different influx of people. It's a fairer approach to recruitment, and it can lead to increased diversity, because I think with some of the competency-based approaches, you can get that recycling of the same people, whereas this approach brings in new ideas and a diversity not only of people but also of thought. And some of the benefits, I've used this process for engaging and recruiting comms staff within the force control room. We needed to recruit quite a few, so it was a bit of a chance. If it hadn't worked, we could have ended up with the wrong people in those posts. Everything we've seen so far, I've said that it was a good idea. We've reduced a 5-stage recruitment process to a 3-stage process. And what we've seen is, in comparison to competency-based, where 35% of people got through the initial paper sift, which is obviously a lot of time that's wasted for the individuals who are applying if they don't have the skill set, and also for those who are going through those forms. Whereas in strength, 65% of those initial applicants actually were successful on that stage. And what we've seen is some statistical evidence and some anecdotal evidence of higher calibre of candidates. We've seen reduced sickness, reduced attrition rates, which is obviously really important when we're trying to get those staffing levels back up to where they need to be, and an increased speed to competence of those individuals who've gone through that process. And what we're going to do to try and maximise our understanding is we're going to be giving some comparisons between 2 competency cohorts and 2 strengths cohorts, and looking at giving the strengths cohort some timed questionnaires to look at what they felt about this approach to recruitment, to look at how that equip them to deal with the training and the tutorship, and then when they've landed in the main room doing the job, how they feel that equipped them to do that. So we'll have a better understanding of the benefits of that, and also looking at the costs of this as well. The strengths-based process not only produces excellent candidates, it's also cheaper to do that, so that money can be saved and used in other ways to improve the service that we deliver. So it's definitely an approach that I'm a big fan of. Next strength there is our positive action program. Mr. Kane is obviously someone who leads locally and indeed nationally on diversity, equality and inclusion issues. We have a team led by Superintendent Mark Khan, looking at our work around positive action and the importance of having a diverse workforce. We've reached or exceeded the 2011 census for our BAME population, which was 3.4%. As of March, our police officer BAME percentage is 3.46%. But we know our communities change, and obviously we're not resting on our laurels and moving forward in terms of that. And there's a lot of work ongoing through the team. We've recently started recruiting positive action champions across the force, who are people who clearly will be motivated and passionate about this kind of work, so that can only help us drive the agenda forward.
So just a quick question on that, Tom. I'm not sure, Tom, if you want to come in, but just a quick question on that. I mean, obviously, we've seen a lot of work around the recruitment, and it's great to see, diverse cohorts of new officers, new recruits. But I suppose, it's more than just recruiting people. It's about keeping people. It's about ensuring that they reach their full potential. It's about promoting people. There's a whole sort of range of things other than just getting people through the door. So, how are you feeling about that side of things as opposed to the recruitment?
So I'll answer that, Commissioner, if that's okay. So again, it is a significant challenge, not just for North Yorkshire Police, but for the whole service. So as part of my national portfolio, I'm the National Police Chiefs Council lead for workforce representation and diversity. And one of the things that I'm in the process of developing with the College of Policing is a development programme for underrepresented groups in the service, but at the entry point of their service. So we do lots and lots of work reaching out into our communities. We mentor and coach people to support them to join the organisation. And then what's really key is actually once they step inside the organisation, that support and coaching and mentoring continues going forward. Now, whether that is to go into a specialist department, whether that's becoming a detective, roads police officer or otherwise, or whether that is for police staff members or police officers looking to seek promotion development. So we are in the process of developing a leadership programme in North Yorkshire Police, again, that will look at support and coaching and mentoring for the whole of the workforce, but in particular for underrepresented groups as well. So we have sent a number of our police officers and police staff leaders on the Superintendent Association coaching and mentoring scheme. So they have come back into our organisation with the explicit requirement that they each undertake a commitment to coach 3 people from underrepresented groups as their commitment towards moving forward in terms of our diversity and inclusion programme. So again, that's part of that. Again, the coaching and mentoring still needs further work in developing in force, linking it to the strengths-based recruitment side as well. So it's not just in terms of recruitment that we use a strength-based approach. As I am an example myself, we use it for our promotion processes as well. So currently, as we speak, there is a Chief Inspector's promotion process running now that is being utilised for strengths-based. As a result of us running our strengths-based promotion processes, from Chief Constable through to Chief Inspector ranks, we are 50-50 representation for gender, male, female. We have a long way to go in terms of our black and minority ethnic positions in terms of rank. Again, you've got myself as a Deputy Chief Constable from a BAME background, and we have Mark Khan as a superintendent, but actually there's not enough representation throughout that. So whilst we have got the recruitment aspects right, we are actively working this year in relation to our promotion and progression elements, and one of those is we are undertaking again fast track inspector routes to bring in fast track from internally to get some of our talent spotted and into some of those positions. Last year we ran direct entry inspector program where we brought 2 inspectors, 2 external people in directly into inspector rank. Again, 1 female and 1 white male Muslim candidate, both now embedded in our organisation and thriving in the organisation. So yes, it's a challenge for us, but we are alive to it and we're working actively to address it.
Okay, thank you. So I suppose it's a similar point really that I made to service, and that is outside of this meeting is for us to sort of really keep an eye on
Yeah.
Tom, did you want to come in?
Yeah, it was just a question really following on from that. Obviously, there's been an awful lot of work done around recruitment, and it is testament to that you kind of passing the kind of demographic level now, which is really good. What I wanted to ask was, how is that knowledge that you're developing within that team around the needs of those communities, and any information that we can glean around the needs of those communities and ways of engaging with them, because different cultural backgrounds, there's lots of different ways of talking to people and engaging with people to get the best out of that relationship. How is that being disseminated to frontline teams? How is the information from all the positive action work now being pushed out, so that actually it's not just about people coming in, but it's about the way we're engaging out as well?
Yeah, so Tom, this is where we're really pushing about being an inclusive service. So one, we need to represent our communities. So then when they look at us, they need to see us, they need to see themselves reflected back, so that we can start to build some trust and confidence, that we will understand some of the concerns and some of the challenges that those communities face. But secondly, for us as well, we need to be an inclusive organisation, because everybody should be able to be their true self at work when they come to work, and that way we'll get the best performance for our communities. So how we go about doing that is our 3 positive action coordinators actively go around the force. They will visit departments, they deliver presentations on positive action, they have safe conversations where cultural differences and cultural challenges can be explored, where staff can feel confident to say, put their hands up and say, I'm not really confident in dealing with this type of community. What is it I need to understand? So those conversations are taking place with down to frontline officers and staff and their supervisors. Alongside that as well, the training department deliver additional training to our tutor constables, to our supervisors and to our new recruits in relation to what positive action means, what cultural differences are. So we've built into our training programme a week of cultural awareness that is delivered to all new recruits that come into North Yorkshire Police. So they will go and they will visit places of worship. They will go and have conversations with our communities. It allows our communities to have an input on how their police officers are being trained in North Yorkshire. And I think that's a really valuable thing for us to say, actually, we need to go out, we need to reach out to our community, and we need to allow our communities the chance to have an input in how their police officers are trained. So we are reaching out and doing that, and we're carrying on doing that. So again, it's a cultural journey that we're on in relation to that. It will take some time, but I think we are seeing some really good positive returns in relation to that now.
And do you think communities would reflect that back to us yet, around feeling that they are better, being engaged better with? Are we getting more reports from those kind of communities, for example? Is there any evidence of the success of that approach yet?
So I will give you one. So I would say I will give you one example in terms of where we've been able to respond. So communities in Skipton raised a concern through one of our black and minority ethnic officers. That officer in their own time has gone and visited that community in an open forum meeting and listened to what their concerns are, and again is bringing that back into force so that we can start to make some of those changes and take those things into consideration, so that we can let the communities know how we are working with them. But the bit for me is there's more to do on that as well, Tom. I think there's more. So whilst we're open to scrutiny, and I think that's absolutely right, we should be even more open to scrutiny as much as we can, we also need to be working harder, and this is where the place-based working and the prevention intervention work that we're doing comes in. We need to be working hard in involving the communities in designing the solutions, delivering those solutions, so those communities are more resilient in relation to how any issues are impacting on them. And I think that's the next generation of where we're looking to take neighbourhood policing and our prevention intervention work.
Thank you. That's good to know. Cheers.
Okay, thank you. Moving on to empowering our staff and our intent-based leadership. It's empowering staff to make decisions and be confident that they'll be supported in that decision making, and to avoid situations where the decision it goes all the way up the chain of command and comes all the way back down again. It's making decisions more in line with where the information is, and making them more responsive and more efficient, so that the service we provide is quicker and better, so it enhances the service that we provide there. All senior leaders within NYP have been trained on 3 separate modules, and training had begun for the fire service, but unfortunately COVID has put a bit of a pause on that, but that will hopefully be resumed fairly quickly. And the last point there, an organisation that's positive about change. I think we've demonstrated that in the change programs that we've been involved in, T2020, looking at improving our working practices and being more efficient, so that those efficiency savings can be reinvested in the services that we provide. We have now a dedicated superintendent for change management in Superintendent Sam Miller. So she can look at where change has taken place across the organisation and help to bring that together and coordinate that. And she's obviously working along with ACC Anderson on the target operating model, and looking at delivering on a number of different projects around that to improve the services that we deliver across North Yorkshire Police. And it just emphasises that we are an organisation that embraces change, and we're always striving to do better. So the next slide is just around the force control room, because when you're looking at enhancing the customer service, it has a key part to play. It is the primary point of contact for the public, and if we get things wrong in the initial contact with the public, then that can kind of affect the customer experience throughout the rest of the organisation. So no matter how good the service is thereafter, if they've had a bad experience from the start, it can tarnish that experience throughout, which is clearly something that we want to avoid. In terms of staffing, I've mentioned we had a number of vacancies. We've got a staffing recruitment plan in place. It has suffered a little bit of slippage because of COVID, but we're on line to be fully staffed by early 2021. Which is a fairly significant achievement from where we are, and obviously having those staff in there is a real positive in terms of our performance. The slight negative will be that there will be a lack of experience among some of those staff, but they'll soon be developed and brought on so that they're delivering an effective service for the public.
So so 2021 seems quite a long way away, put in the context of some of the feedback that we've had from the public today. And we can always tell in the OPCC we get when performance in the control room goes down, the numbers of complaints into our office go up correspondingly, and we know when there are issues because of the direct feedback that we get from the public. And it's also some of the mitigating measures that seem to be not as effective as they were. So things like the callbacks and those sort of things, that people taking a long time to be called back. And I suppose it's trying to just sort of really focusing in at what can be done in the short term to improve the performance around this, because we've been here before, and we've had significant improvements. And I understand the COVID context, and I'm sure a lot of members of the public do as well. But it is the numbers of complaints that we're getting at the moment are symptomatic, I think, of some concerns at the minute.
Yeah, and unfortunately, when I come on to some of the statistics, the increase in 999 calls has had a significant impact on our ability to deal with 101s, because clearly we have to prioritise the 999s, which means less staff available for the 101s. We have been bringing in staff on overtime to backfill some of these gaps. Obviously, we are also now in peak leave, which was being exacerbated by the fact that people haven't taken leave during the lockdown. So we are working to smooth some of those issues until we get the staff in.
Okay, but we're still reliant, aren't we, almost exclusively on 101? And I suppose, what about, single online home, other channels, all of that sort of stuff, because we just have this sort of crunch point, irregularly, and we've got to try and find a way. I mean, there is some fairly good evidence out of the single online home program now around reductions in call volumes. You've still got people have got to deal with the emails and the other things, the other ways in which people could communicate, but it's less intense because from the member of the public's point of view, because they're not just sat there on the phone.
Yeah, absolutely, and I'll come on to some of the things that we've been doing around opening up other channels. And to give an example, Commissioner, we were given the opportunity to take an element of single online home prior to the full package, which was around COVID reporting, and we did that. And we had, from the 25th of May, we've had 1,002 submissions on that system. 24% of those had rang 101 initially, and then put the phone down when they heard the option of reporting that via online. And 45% of the people who responded to that said that they would have called 101. So there's a clear example there where if we open up another channel, people will use it. And obviously, as you say, that benefits us because then that demand is diverted away from 101, and it can be dealt with efficiently and effectively through that mechanism.
Okay, so the obvious answer is then, if you've managed to do that to deal with COVID, is there not a way in which you can manage to deal with that when demand gets difficult in normal quote unquote circumstances?
It's difficult to divert somebody once they're on the 101. The diversion there was because we knew that was an option for them, so we put it on our options list. We are engaged with the single online home project team nationally, and we are looking to bring that in as soon as we can. Again, they've suffered some slippage because of COVID, and we've got a meeting with the national leads for that next week to try and bring that forward, because again, that will open up a number of avenues for people to report in various elements.
Yeah, but it's not just, I mean, there's functionality in online homes. There's services that are actually, I've been part of the national programme, so I know what it can do. So which again reduced the requirement for people to actually call. And also there's obviously been I mean, it's a while since we did the research around the use of the control room, but a lot of partners calling as well, trying to contact people and trying to make sure that we divert those away from call handlers who should be serving the public, and those making sure that those systems are working as well. Phil, did you want to comment?
Yeah, it's just to reassure you, Commissioner. Everything you're saying is absolutely right, and we need to explore all of this under ACC, Annette Anderson and Jason. I know that Annette is keen to look and explore as to what the short-term plan can be for us to deliver against this. Again, we've got to recognise that we have had significant investment in our force control room, the new training facilities, the extra staff. We need to make sure that we are maximising that investment as well, and we don't slip behind in terms of that. So just to give you the reassurance here, we absolutely understand the concerns that are being raised by the public and yourself, and Annette Anderson and Jason will be on and prioritising that.
Okay, that's great, because obviously, I put council tax up to pay for improvements in the control room, and when they're not coming online, that creates a problem.
Yeah, I mean, I think we saw, earlier on in the year, we did see some significant improvements in performance, and I think what we've got to do is understand the combination of COVID and other things. Why are we seeing that slippage back a little bit? But again, to give you that reassurance, it's an urgent priority, and we will look to address that to make sure that investment's not lost.
Okay, thank you.
Just to mention briefly, increases in demand nationally. We're seeing an average 5% increase year on year for 999 calls. We've seen an increase in calls coming in that really should be going to other services, but because other services aren't in a position to take those calls, we're kind of the agency of last resort. And obviously we need to look at how best we manage that and divert that to other organisations as and when appropriate. We've covered
Sorry, can I just say there's a debate going on about devolution at the moment in North Yorkshire, and it seems to me that this is a perfect opportunity to work with our partners around some of this. So I shall put that on the devolution ask list which is how we work together as a local authorities and PCC to try and sort of deal with some of these. That's an opportunity that we've got at the moment. So I will pick that up.
Thank you. We've covered the increasing the number of options for the public, as we just discussed there, other avenues to contact us. Complexity of calls and call handling requirements. Again, this is reflected nationally. Calls are becoming increasingly complex. We're dealing with people with significant mental health issues, with drug and alcohol addictions, and just the complexity of some of the criminality now around cyber-enabled crime and things like that just means that the calls are a little bit more complex and need some additional questioning from the comms officer to fully understand what is being reported. I'll come on to some performance data in a little while, and hopefully to try and give a little bit more context to some of our performance of late. Not trying to make excuses at all, because I think we accept that we're not where we would like to be, but to give a little bit of context around that. For example, we have a national list where forces who go outside of 2 minutes for 999 calls, if that happens more than 50 times in a month, they feature on this list, and some forces feature month after month with significantly high numbers. We haven't featured on that list since February, and we're working hard to hope and achieve that and continue to achieve that, because obviously we recognise the importance of responding to 999 calls as quickly as we possibly can. And I think that's moving on. This slide just to give a look.
Just on a timing point of view, I know. Again, it's our fault. We've got sort of 5 minutes to finish this before you eat into your presentation time on performance. Just as a heads up.
Right, I shall go very quickly then. That's just to give a little bit of context to the amount of demand coming in. 22,000 phone calls, and again, going back to the options there's 6,000 emails coming into the force in various boxes, and there must be another way of us receiving and dealing with that information that's more efficient, and they're the kind of things that we are looking at. I won't go through all of these, but this just gives an indication of the kind of things that a comms officer has to consider on each and every call that they receive. There's a lot to do there. If we take things out of there, it just pushes issues further along, because then we don't understand the issue in depth. We can't prioritise our resources, and our data isn't as accurate as it should and needs to be.
Jason, I'm sorry, I'm going to slow you down even more there. Just because there was an HMIC point around the way that we record Thrive. Yeah. I just wondered if you could update us on that and how the force have assessed that and what work is being done to think about the way that call handlers actually record the Thrive assessment effectively.
Yeah. Previously, the Thrive assessment was kind of left down to the individual to decide if they should or shouldn't record their considerations around Thrive. What we've done is we've made it an automatic process. So there is the Thrive list appears automatically on the job. So the comms officer basically has to fill in those different elements. And what we've been doing is doing audits of that, including auditing the call itself, so that we understand what information has been asked of the individual by the comms officer to answer those Thrive questions, and then does what they record on the log actually match what they've been told? So is it an accurate recording of what they've been told around Thrive? There's still some work to do around that, and obviously with us getting new staff in, we still need to embed that with them. But that automated process is the prompt that they need to say, you don't really have a choice in this. You need to consider this for every call, because clearly it's vitally important that we use that to be able to prioritise our deployments and make sure that those in need, the greatest need, get the service first.
And when if there is ever an assessment where some marking against that Thrive analysis has been marked off or exists, yet a deployment hasn't been made, is there any sort of assurance around that the service undertakes to kind of consider whether that was the right decision in the end?
Yeah, there's a number of safety nets that we have in there where particularly certain types of job are reviewed. We have what's called a FIM list. So incidents that we know will usually contain a degree of vulnerability will go to the control room inspector to review, to make sure they're happy with what's the planned deployment is and what that priority is. And the priority of deployment can be changed at any time. So if a supervisor picks up on a particular incident that they don't agree with that, they can rationalise the prioritisation being higher. And similarly, our dispatch staff can do that. And similarly, if an incident goes through into our service desk as a pre-planned appointment, when they review that, because they triage them, they might think, we can't wait 2 days to deal with this, and they can reprioritise that back into the control room so someone can be deployed. So we do have safety nets in there to manage that if officers haven't, really sort of understood the threat that was there.
Thank you. And just sorry, last one on this. Just in terms of the automatic Thrive pop up and the work that's been done around that, do you get the sense that there is a better understanding and assessment of vulnerability within the force control room and the way that call handlers and dispatch officers are dealing with those calls now?
Yes, I do. We've also established leads for various areas of vulnerability within the control room. So some of our deployment managers are taking a lead on domestic abuse, stalking and harassment, serious and organised crime. So we're looking at the key areas of vulnerability and making sure that we have identified people who will link in with colleagues across the organisation who are dealing with that, make sure that our knowledge within the control room is up to speed and that we know what's happening, and they can disseminate that across the rest of the team so that the staff within there. And we have what's called a scratch pad, which the deployment managers and the supervisors can actually put a message on there which instantaneously appears on everybody's computer who is logged onto a force control room computer. So, if there's an issue or something that they need to be aware of, they can be made aware of it straight away. We don't have to wait for briefings and things like that.
Thanks, Tom. I'm now managing you. Okay, Phil, do you want to come in?
Just very quickly, Julia, I'm just conscious we've just had a conversation about Thrive and the public might not know what Thrive is. So it's an acronym for the way that the control room assess incidents that get reported in around threat, harm, risk, what are the investigative opportunities, what's the level of vulnerability, and what type of engagement do we need to do for each of the incidents. So it's just a quick explanation on Thrive.
Thank you. We do fall foul of some of the jargon at times. Thank you.
Okay, I'll go through these graphs fairly quickly. This is the 999 calls from January through till December 2018, 19 and 20. You can see a peak there, which is similar to the peak we're experiencing now through the summer. Obviously in 2019 it was a significant peak. You can also see in April the number of 999 calls has dropped dramatically as a result of the lockdown, but you can also see that the upward spike has started, and we've seen that continuing, which is what has been impacting on our 101 performance, because we've having to manage those increased numbers of 999 calls.
Okay, so that graph worries me a little bit because it suggests that we are nowhere near sort of peak demand on 999, yet we've got all of these issues in the control room.
Well, if you look, Commissioner, July is the peak, so we're already into July. So if it mirrors those from previous years, we're actually starting to be in the decline of those lines.
Because this graph is a bit out of date.
Yeah, these are the last 2 years. So if this year's 999 mirrors that, then we're already over the peak and starting to get into that downwards thing.
Yeah, it's old data, isn't it? So that's fine. That's no problem. Tom, did you want to come in? No, he doesn't. Okay, keep going.
Thank you. This is 101. You can see there that we didn't experience a significant change in 101 during the lockdown, but what we did experience is a change in the type of calls we were getting. So obviously previously we would never have had COVID type calls, and what we've had is we set up some tags for COVID-related incidents and also incidents where COVID was a risk to officers. So we had a question set we were asking the members of the public to see if it posed a significant risk, and we've had 6,800 COVID-related incidents, which are incidents we would never have had prior to COVID, and we had 488 COVID-related issues. So there's a COVID threat to the officers, so they had to take additional PPE.
Okay, so the other worry is we're obviously got a lot more people in the country over the summer because there's fewer people going overseas, and whether actually we could end up with the situation being a whole lot worse than in previous years because of that.
It's difficult to gauge. I mean, the other thing that impacts on it, of course, is the Great British weather. You know, we definitely see when it's rainy, we have a reduction in demand. When it's sunny, we have increases in demand. There's a number of factors to play, and obviously this is a unique situation. We've never had this before, so we've got no comparables to say that the increase in or the reduction in people going abroad is going to impact on policing services.
Yeah, but we did see during lockdown, didn't we? And those sunny days, we did see big increases in demand. And
we did.
Yeah, so I mean, I just feel it goes back to my concerns around this, really, around this, and I sort of needing some reassurance around it, really.
I think, Julie, just to come in on that, sorry, when we look at the performance pack, it has June's figures in there as well. And I think it doesn't show that there is necessarily the same degree of spike as has been in the past 2 years. Yet the average speed of answer is still significantly higher. So, yeah, I do think we probably do need to pick that up.
Yeah, and but also we've had rubbish weather, haven't we, over the last few weeks as well? So it's just a worry, really, at the minute.
Yeah, we'll pick that up, Julia, and we'll make sure we give you some reassurance around what the plans are.
Okay, thank you. So if you want to if we've got this in the, we'll deal with this now and not do it in the performance pack. I don't want to do it twice. So take a view on whether you want to go through this now or you want to use the more up-to-date figures that are in the performance pack.
I'll zip through the next couple. This just gives a little bit more context to our call answering. So that's the last 3 months, 999, and the percentage of calls answered in intervals. So you can see from there that 60% of 999 calls are answered in less than 4 seconds. Which I think is a real positive. Obviously, the area that we need to focus on is the 25% that are answered in more than 20 seconds. So we're trying to understand our data better so we can focus our activity. But as I say, I think in terms of 999, 60% in less than 4 seconds is a positive. 101s, apologies, the pie chart isn't cut particularly accurately there. Again, looking at that, 75% of our 101 calls are answered in less than 5 minutes. And I know we do get a lot of concerns raised about those longer calls, and understandably so. And again, it's not where we want to be, but less than 2.5% of people are waiting more than 15 minutes for 101. Again, I'm not trying to make an excuse around that because it's not where we want to be.
No, this is not where we want to be in any shape or form. So no. if people are, when we did our original research on this, people said 2 minutes, and even then that felt like a long time. So we're quite a long way off here.
Yeah, and looking at the averages, I think we're around about sort of 2 minutes 30. But again, it's those outlying calls that really impact on that average. And they're the ones that we really need to address. And
it's those that really annoy the public, and
absolutely,
that's how we get all the feedback, and then it in turn undermines confidence in the service, which was the point that you were making at the beginning. Anyway, I'm not going to dwell on this because we know it, and Phil has says you're on it, so I will leave it there.
Thank you. So challenges, we're looking to modernise the technology within the force control room. It's a very technologically rich environment, as I'm sure you'd appreciate. and we need to keep modernising that in order that we keep up to date with technology, and we can gain efficiencies through the use of technology to reinvest that officer time in looking at call handling and the other issues that we've already discussed. Looking to reduce demand coming into the FCR, particularly repeat demand, so looking at what we can do around with partners around problem solving, people with mental health issues, and things like that, to try and reduce that repeat demand coming in. Becoming more proactive and less reactive, as we've discussed, around dealing with issues rather than just reacting to them and getting ahead of that curve. Increasing the number of options for the public to contact the police. Again, taking some of that pressure away from 101 by providing people with other avenues. I know a lot of young people have no interest in actually talking to people on the phone. It's all messages. My children certainly would never ring anybody. It's all messaging. So we need to adapt our systems to allow for that, to provide the service that the public actually want, and that accessibility. Improving the efficiency of managing low-risk crimes and incidents, looking at how we can best resolve incidents without necessarily physical attendance of an officer, and there's work ongoing around that. And the current COVID challenges and learning. It's about, we've had to adapt obviously to the way we work to deal with COVID, and it's about making sure that the learning that we get from that isn't lost when COVID ends. So if we've developed processes that are more efficient than the ones that we had, then we should use them as best we can to improve our service.
We really do need to speed along now, Jason. You've gone 10 minutes into your performance time, and we need to get a crack on and move on.
Okay, very quickly then, we have a dedicated chief inspector to look at service improvement. We have a project underway to look at modernising the technology, so that's in hand. The TOM work, I'm sure you're aware of, is being developed to focus on prevention and early intervention to reduce some of that demand from occurring in the first place. Single online home, web chat and video conferencing, we've touched upon those. Strengths-based approach, again, we've touched on that. And investment of Precept to increase the alignment resource deployment, which is looking at how we can resolve incidents while still providing excellent service, but without necessarily having to send an officer, and the use of video conferencing and other approaches is what we're going to do to try and achieve that, to free up time and resource to do other things. What we would hope to achieve is increased customer choice and customer satisfaction, improve call handling performance, which I'm sure is important to everyone.
So I don't want to go through all of this slide, but what I want to see are some clear metrics around this.
Okay.
So it's all very well saying that that's what you want to do, but actually, what are you aiming to do? And so I'd just say, let's leave it there. Can you come back to me with outside of this meeting some specifics here? Because this is aspirational and it's not specific, and I need to see some specifics.
Okay, Julia, I think if we take that commitment away, then Annette and Jason can go and work on and present a plan back to you with all of that, with it built within it.
Yeah, because this is yeah, that'd be fantastic. Thanks, Phil.
Okay.
Okay, sorry, Jason. I know we've done the questions, which is fantastic.
That's it. I'm done.
Okay, Tom, have you got anything else you'd like to add?
No, thanks.
No, super. Okay, let's go on to the performance then. Simon, in advance, do we have any public questions?
We've just got one comment so far, which I'm just sending through, but not a lot of them.
Okay, that's great. That just enables me to sort of manage the time a little bit better. So, so in which case, then you've probably got a 5 minutes extra on your performance pack due to that. So, if we can try and finish this element of it by within 15 minutes, that will be super. So, thank you.
Okay, good afternoon, Commissioner.
Hello, Annette. Welcome.
Hi, I'm just, the pause there was I'm just sharing my screen, so I'm just making sure that you can see it.
Yep, perfect. Thank you.
Right. Okay. All right. Thank you very much. So I will just start with the first slide, which is on mental health. As we have seen previously, since a change in the recording of the definition, we've seen a static, so from an increase because of that change in definition, it has now become static. Mental health tags have accounted now for 13.75% of all incidents. Of course, we discussed this on the last month's PAM about any changes due to sort of COVID-related mental health issues. We've not seen a significant change from that. However, obviously through the work with our partners, Mental Health Concordat, we will continue to look at addressing that as we come through the recovery phase of mental health, and making sure that our services, not just within the police, but within our partnership, provides that support. In terms of 136s, there has been none brought into custody in June, and there were 2 that were presented in custody that then went on to taken to another place of safety in terms of an assessment. Moving on to the number of incidents taken into 136, we had 22 last month, which is still slightly lower than pre-COVID. What we have found, and we mentioned this last time, there was 1 month, the 1 month that we'd seen a slight decrease in terms of admissions into hospitals. So normally we would see around about 70%. Last month in May, it was about 50%, and it's further decreased this month to 22%. As a result of that, I think there's further work now I'm going to commission, or there's further work I'm going to commission to look at all those cases to see if that's an impact on our sort of health colleagues in terms of admissions, or if there's a patting in terms of those 136 and the decision making within that. So I'm going to request some further work to be done now that we've seen 2 months decreases with that. So again, it'll just be able to understand if there's any COVID related changes.
And sorry, just to comment on that, it'd be particularly interesting to understand what engagement was had through the force control room triage before those sections were made, especially the 17 that weren't admitted. I think from our perspective, just to understand the way that that's being used, because a lot of work has obviously gone into that service in the force control room. So it would be interesting, please, to understand that as part of that.
Yeah. Okay. All right. Yeah. And I can bring that back either out of the meeting or back in for an update next month. So moving to total incidents and crimes. Again, from last month, we've seen and explained there was been a significant decrease in the number of incidents, and we've seen that again in June. Not so much. We are going back to pre-COVID levels. So there was about a 13% decrease in incidents from June last year. So although we are seeing an increase, which we anticipated as we moved out of some of the restrictions of lockdown, it's still not back to the same as what we had last year, but it is moving to that level again. In terms of crime, again, we have seen increases that would be expected pre-COVID, but certainly, again, not at the same volume. So I'm just moving to the overall crime total for the first quarter. So last month, we'd seen around about, in total, about 37% decrease, really across the board in most of the crime. It is 32% decrease, and it was around about a 25% decrease in June, about 1,000 crimes less than last June. So we're seeing that. We are carefully monitoring the changes in crime through our COVID operational response phase as well. So we're still having a close monitoring of any changes in crime changes, antisocial behaviour, so we can make sure that we're able to be agile in our response to that. As we know, it's quite fluid and changes in relation to the impact of COVID, but overall, you know, we have our structures and control in place in terms of responding to any changes. But again, sort of significant decreases overall. So again, that just gives
just one thing. I'm sorry, I'm not sure if you're going to come on to it. Are you going to talk about domestic abuse at all?
Yes. Yeah.
Right, fine. Okay. Thank you.
There's a slide on that. Okay. Which leads me to the domestic abuse slide. So
sorry, Annette. Can I just ask quickly about drugs on the previous slide around Craven?
Yeah.
Because obviously there is a significant increase on the number of drug offences from last year. There is there anything specific that you're able to tell us about that at this point in time?
Yeah.
Generally,
a hypothesis out there.
It's cannabis related. I think it was around about 20. It's still, in terms of volume, a smaller number of it. So it's cannabis related, and it is. We were having more patrols out during COVID. We were doing more stops, and we're sort of pretty confident that's the related to the increase.
Okay.
Yeah.
Thanks.
So because you were really out there stopping people, weren't you? So I mean, I suppose the question is what lessons have you learned from that, and are you going to continue doing it?
Absolutely. So there's an awful lot of lessons that we're learning through COVID, both some of the short-term ones. So whether it is within our proactive policing, which we are still through that response phase, or through again, I don't want to stress in terms of what the last discussion was in terms of the FCR, but we do have to put some very short-term measures in place, improvements to address that. But we can kind of relate this across the board with a lot of crime type and impact of policing, COVID on policing. But yeah, certainly we are kind of learning as well as we're going along, but I think we're responding quickly to those. Just in relation to that, and we have also conducted the survey with our staff, and we've got the results from that. Really encouraging response. There was 900 responses. Included in that, it was about people welfare, but we have asked for their views about good practice, what improvements could we make, both in efficiencies within crime. And we've had 580 responses in terms of improvements that we can make. So again, we're collating all that. We're collating about our proactive response during it. And there are some short-term, sort of measures that we are going to put in place in terms of the improvements. So there's a lot. I'm just trying to give you the confidence that we are doing an awful lot in terms of understanding what the information data intelligence has been telling us throughout this period and reacting to it. Okay. So in terms of domestic abuse, so we know that the increase roundabout, which we start seeing at the early part of 2019, was through changes in definition crime recordings and crime recording. We still haven't seen, in terms of the incidents and crime, a change in any increase through policing in North Yorkshire Police on the levels of crime that's been recorded that we wouldn't have anticipated anywhere as a result of that. Of course, we know that now that pubs are open and football and other events are opening, and that we're coming into the summer months, we're mindful that we have got our service and provisions in place to respond to domestic abuse. So we are still having the weekly multi-agency domestic abuse meeting that has been really effective and being able to respond to domestic abuse victims, perpetrators throughout the COVID period that we still will be monitoring and being able to respond to in relation to that. A further bit of work that we have done, and this was been some real quality assurance work, is domestic stalking and harassment and domestic abuse. So we've done a real deep dive in relation to that as well, and we've got some intensive activity ongoing, which I know that Tom cited on in some of the work as well in relation to that. So again, it's just to give you the reassurance that we are really monitoring and responding to domestic abuse. That is in also
just on. So a pet peeve of mine is stalking and harassment. They're quite separate and different. So sorry, just to pick up on that. Also, I suppose it'd be interesting to. I mean, you know, this is clearly an area that we've been focusing on quite a lot, and I'm pleased to see. I think actually some progress around all of this. But I will. You know, we'll want to keep an eye on that, and in particular around sort of control and coercive control and those sort of aspects of it. We've also, as you're aware, been successful in getting quite a lot of additional funding in around support services, and also with the police, with the precept uplift last year. And I suppose it's trying to make sure that my commissioning team and the force are joined at the hip on this, and that they, you know, it's a symbiotic relationship, if you like, and that we really do have in place the support that we need.
Yeah, absolutely. And a deep dive has revealed some sort of real areas that we can make some quick improvements on in the action plan. Going back to your point, one of the recommendations or the actions is to stop calling it stalking and harassment together, but stalking and harassment. And well, not, you know what I mean? So again, just changing terminology
like that. But anyway, yeah, thank you.
Yeah. So there's an awful lot of work being driven by Superintendent Alan Harder with that, and more than happy again out of this meeting now to bring it back to show you the improvements that have been put in place for that.
Yeah, I think that'd be great. I mean, obviously, I'm aware of the work that's going on in Scarborough as well, and those sorts of things. So, I mean, this is one of the areas in the office where we get the greatest sort of triangulation, if you like, of service issues around service delivery, and some victims who've had, you know, some real challenges. So it's really welcome.
Right. Fantastic. Well, you know, of course, we'll just keep you updated in relation to that. And then secondly, with domestic abuse, again, we know that some of the support services, charities, refuge has seen a significant increase. And we have done that work to understand why maybe that has been the case, but we're not seeing it through incidents and crimes. And there's a sort of a plethora of reasons why, some of it COVID related. But again, just to reassure you that we are tapped into those partner agencies, just in to make sure that we really understand the data and information coming from a variety of agencies and sources. Okay, so moving on to the antisocial behaviour, the same as last month, we did see we've seen a significant sort of increase across the board. The majority of that is, we'd say, COVID related. So we had very early on put in a system in place so we could capture the COVID related activity. So there are sort of some data caveats on that, but we did see a sort of a 10% related COVID related in June, and also 20% related to youths. So again, it's not kind of just accepting that it is just COVID related. So there's more work that we're doing to really dig under what does that ASB increase really, you know, sort of involve, so we can able to respond to that. Tom?
Yeah, so it's interesting because obviously last year we were talking about massive decreases in ASB at these meetings, and I think we had a number of questions about how that was being achieved and whether it was difference in crime recording or whether there was elements of partnership work. So I think I'm going to caveat what I'm going to say by an acknowledgement that these increases are against very low and decreases in the year before, but it is quite significant there. And I think it does highlight the concerns that we were potentially raising there about what the actual root cause of those decreases was in the first place. Can I just ask, in terms of, obviously, one of the issues probably was also around the fact that all kind of partnership youth engagement activities, work that councils are doing, youth services and so on, kind of also came to a stop during the crisis. What engagement is being done with partners around finding ways to restart some of those services that might have been part of the answer last year that we were seeing? So we have seen some fantastic examples of that work not stopping but continuing through some innovative working through what we're doing now through teams. So actually in some of those areas we've actually seen improvements in partnership working, safeguarding, attendance. So again, it's not that activities and conversations and problem solving has stopped. We're just doing it in a different way. Again, being captured both from a number of sort of, whether it's safeguarding, community safety hubs, through that work has still been ongoing. Of course, there will be parts of it that has been hampered around the face-to-face engagement and some of that other activity. But again, what we have seen is, particularly around sort of the beauty spots that we've seen around Richmond Falls, for example, there's been some really good partnership activity. Mr. Kane, do you want to come in?
All it is I just think we need to, yes, we absolutely need to understand the issue, but I think we need to also recognise that this could be an extremely unique year for antisocial behaviour. There could be a perfect storm in relation to this. Lots and lots of people working from home. We've got the schools all closed. We've got partners not necessarily able to deliver what they could deliver beforehand. So there could be a perfect storm around antisocial behaviour here that I think we need to just be mindful of in terms of when we react to the numbers that we're seeing.
And also ASB will come in largely as 101 calls as well. Yes,
it will.
I completely agree, and feel that was really the point of my question in terms of what are we trying to do to at least manage, if not get on top of some of this. I know it's not necessarily going to be possible because of that perfect storm that's in place, but if that is going to be creating demand in force control room and local neighbourhood policing teams, then it's just interesting to understand the approach that's being taken.
And I think we still need.
Sorry, just add to that, community confidence as well, because ASB can really undermine community confidence.
It does, and I think we still need to put together the operations we would normally put together for school holidays, etc., and things like that. But I think what would be an interesting point for us to see will be when the schools go back in September, whether that has any impact on antisocial behaviour levels. So I think, yes, we need to understand it. Yes, we need to respond in the same way we would do for the summer holidays for schools and other things as well. But so again, it needs further work. But I suppose it's just a case of we just need to be mindful that this may be a unique year for that, and I suspect it will be when we look at the figures in following year.
Thank you.
Okay. So that gives, again, sort of just the indication of some of the work around rural task force. It's a busy slide, but to give you assurance that there's still an awful lot going activity in our communities, which then takes us to the areas, the FCR, which we've already discussed. So I'm not sure if there's anything further on that. I don't think so. So the final slide just gives us a summary as to where we are in the first quarter from April to June.
Okay, fantastic. Okay, so I mean, it is an odd picture, isn't it? It is what it is, I think. Okay, so that is fine, Annette. Tom, is there anything else you'd like to add? No,
not at this time, thanks.
Okay, fine. So Annette, thank you very much for that presentation and for going through that. And Phil, thank you for your and Jason, your contributions. That is much appreciated. I think that draws us to our close. We've had one question via Twitter from Gwen Swinburne, which is, I don't mean to be unkind, but I have no idea why we have to carry such a heavy staff load in your office. Presumably that's my office. The new mayor, I assume, will take over and hopefully streamline the staff. All that money could be spent on police. I mean, I do think that's a little bit unkind today because we have, for example, just been successful in getting a bid for over £500,000 money into North Yorkshire as a direct consequence of some of the work that the team has been doing. So I'd like to thank Tom and the team for all of that hard work, because that really will help with, for example, burglary in some of our rural areas. We've also been successful in about the same amount of money to support our victims' services as well, which is nearly getting to the total cost of the team. So I think the team, you know, really has done an absolutely cracking job over this period of time. They've worked so hard in quite difficult circumstances, and I'd just like to take this opportunity to say thank you to them. If we could, I think if there's any other business, anybody got anything they'd like to raise? No. Okay, then I think we are just about there. So I'd like to say thank you to everybody who's participated for your openness and transparency and a good quality conversation. So thank you very much, everybody, today.